Hey everyone, it's Christy, and today I went for my first trimester screening, which involves having an ultrasound done and also blood test done. And the ultrasound test that I had done was to determine whether or not the baby has any birth defects or any indications for Down syndrome, and the blood test also will detect that as well. And what they do with the ultrasound is that they um, like test they measure the it's called Nuchal translucency, and it's a measurement of the fluid filled space at the back of the developing fetus's neck. And any extra fluid in this space indicates that the fetus is at a higher risk for certain birth defects. So that's what I had done first. So I just figured I'd explain it. Maybe it'll help some people that are going to have it done. Maybe that you want to know what's involved, and this will help prepare you. So what I did was I went into the room for the ultrasound, and I laid down, and they just, put the ultrasound thing on me, and they had to position it in such a way that the baby's head or neck had to be in a certain position, and it was quite stressful actually, because the baby wasn't really cooperating with the technician, and the technician, of course, I had a man. Like, who has a male technician? I've only had female technicians, and for some reason I had a male today, and he looked like he was not on the happy side. So I was trying to lighten his mood by chit chatting with him, but he was saying that it could take anywhere from a few minutes up to an hour to find the correct positioning in order to get that correct measurement. So finally we got that done, and then after that, a quick finger prick to draw some blood, and they just he dotted my blood about 6 times. I think you only need 3, but 6 just in case you need extra copies of it, and that's going to go off to the laboratory, and that will then test for the Down syndrome. So then I had my regular doctor appointment after that, and she's able to read the results right away. And right away she told me that everything looked like it was normal. She said that the test results are showing that everything's in the normal range, and that I shouldn't have to worry about the blood test coming back with a positive result. But she said that there have been some false positives, obviously. But pretty much she believes that everything's okay, and that test, the blood test, takes 1 week, about a week, to come in. So they said that they will call me regardless of the result, whether it's positive or negative. And so that's something that I will feel a lot more relief once I know that result. But then again, it can be a false positive, which, of course, this is my third child. My first two, I never got a false positive, so I'm hoping for the best. And of course, when you get an ultrasound, you get to have pictures. So he gave me 2 of each. Now it's really crazy because I'm only 12 weeks, but that's like a 3D scan. It looks really crazy. It just looks, the baby's in the middle, and it looks like a bird. And when I first seen the baby, I was like, oh my god, it looks like a bird. And then of course they gave me your regular traditional kind of picture, and that looks like a bird also. So right now the baby looks like that, and he told me that he or she is about 2¼ inches long, so not very big at all. Yep. So that's exactly what I had done today, and yeah, that's about it, and that's what happened. So they also give you a booklet on something. It's called First Screen, and it does say that you can take this test anywhere between, I believe, 10 and 14 weeks. But I guess 12 weeks is really probably the best, because it's in between. Otherwise they can't get an accurate measurement of that fluid because of the space that's there. So I guess it really has to be done. I know I had it with my other 2 girls around 12 weeks as well. So that was a long time ago. So yeah, that's it. So I hope that it helps, and I'll see you next time. Bye.